Hi, I'm Dr. Paul Greenacre, and I have a private practice in Ottawa, Canada, and I would have an office mission with all my patients to have them change their perception of how they see dentistry. Because I see dentistry differently now after 40 years of practice. When I was a student at McGill in the 70s, I had a chance to go to the Sir William Osler Library. And Sir William Osler was an interesting man. He said, the mouth is the mirror of all disease. And I read that, the mouth is the mirror of all disease, and it made no sense to me at all. Now, 40 years later, I can explain that to you. The mouth is indeed the mirror of all disease. In fact, your mouth is critical to how much oxygen you get during the day and when you sleep, especially when you sleep. And gum diseases and tooth diseases are critical in how much inflammation you have in your body. And that's a critical thing. In fact, there's probably over 100 different diseases that relate to maladies in the mouth. The third major factor is when you have a jaw imbalance or a jaw joint dysfunction, you can have neurological distress, which means you never get to relax and digest your food well. And I don't think very often dentists or physicians are really well trained in the neurology of dentistry. And the neurology of dentistry is interesting because it starts with the human tongue and the human swallow. The tongue really is the anti-gravity muscle that pushes up against the palate, especially when we breastfeed for 2 years, our children, as all mammals do, except some human beings are no longer doing that because it's not the trend today to breastfeed. The trend is getting away from breastfeeding. Well, I'm going to give you 100 reasons why we should be breastfeeding, and maybe we should be paying mothers $1,000 a month to stay at home and breastfeed, because it's the #1 health measure in North America that is being neglected. So if you want more information, email us info@dolphindentistry.com or phone us 613 to learn more. Call 234 and 5758. Make a smile date.